Okay. Good morning, Co-Chair Senator Friedman and Representative Long, and to the members of the Joint Committee on Healthcare Financing. My name is Lisette Blondet. I live in Yarmouthport, and I am here today as the proud Executive Director of the Massachusetts Association of Community Health Workers, also known as MACHW. I support Bill H. 1184, an act relative to health equity and community health workers. Community health workers are the health equity workforce. They bring healthcare to the living rooms, churches, bodegas of our most vulnerable neighbors. Community health workers serve as a service extender and are a bidirectional bridge to clinics, hospitals, boards of health, and social service agencies. In Massachusetts, community health workers are primarily Black, Indigenous, and or people of color. 45% are bilingual. Because the majority of community health workers live and play and work in the same neighborhood as their clients, community health workers are able to build trusting relationships with those they serve. Community health workers bring information, resources, and build the capacity of their clients to live healthier lives. Community health workers also enhance the capacity of health and social service teams to better understand the socioeconomic context in which their patients live, and as a result, enable care teams to provide critical non-medical services that help clients access and adhere to services. There is compelling evidence about the impact of community health workers in reducing health inequities, improving health outcomes, and increasing quality of care. Yet, community health worker practice is not standardized, and funding for the workforce is inconsistent at best. I'm sure that you have heard many terms that refer to the same individuals: community health worker, navigators, outreach worker, promotoras, etc. Many community health workers live, their salaries are paid through grants. So at the end of June every year, they are terrified that their jobs are going to disappear. Many community health workers lack a job description, and in spite of their training and attributes, receive salaries that are at minimum wage. Despite the hard work of the legislature, MACHW, and our partners, we still have a long ways to go to anchor and support community health workers. We are not treated as equal colleagues in the healthcare systems. We have limited pay and very limited opportunities for advancement. You know, one of the worst parts is how little other providers understand the many contributions community health workers make to the team itself, and then to make healthcare accessible to all. In a few minutes, you're going to hear from community health workers, clinical colleagues, and administrators about the importance of reimbursement for community health worker services and the urgency to add behavioral health as a core community health worker competency. Bringing legislators, payers, clinicians, administrators, and community health workers will help clarify roles, goals, and visions. So I'm here to voice my strong support for the creation of a stakeholder task force. Such task force will propel our collective efforts forward by identifying multi-sector solutions to old and emerging issues that have kept the workforce stagnant. MACHW and its members are part of, and I'm very happy to say that we have over 2,000 members across the state, but we have a long history of collaboration with you. In fact, in 2010, we succeeded in passing landmark legislation, creating a pathway for voluntary certification of Massachusetts community health workers. And then in 2012, we worked with the Department of Public Health to formally adopt core competencies for community health workers. We value the relationship that we have with the state legislation the legislature and want to create structures like the task force that improve health equity and support community health workers. Let's continue this legacy. I look forward to your vote in favor of Bill 1184. Actually, we look forward to working with you in finding solutions to the chronic issues that we've been listening to this morning, that it seems like we all have many issues in common. So thank you so much for listening, and we look forward to your support.
Thank you. There are testimony from members of the panel.
Yes.
Go ahead.
Good morning to Chair Senator Friedman and Representative Long, and to the members of the Joint Committee on Healthcare Financing. My name is Shanina Rosado. I live in Springfield, Massachusetts, and I am here on behalf of the Massachusetts Association of Community Health Workers, also known as MACHW. I support Bill 1184 and Act relative to health equity and community health workers. I recommend adding behavioral health, mental health, and substance use disorder services to the list of core competencies for community health workers as outlined in Section 1 of the bill. I have been in the role of a community health worker for as long as I can remember. My first job as a teen was to educate peers about STDs and HIV/AIDS. I then earned my bachelor's in social work. As a community health worker, I have been in a variety of roles, which includes behavioral health discharge specialist, community resource specialist, and health outreach worker. In 2022, I started working for MACHW as a manager of member engagement, where I support community health workers in the certification process with trainings and other professional development opportunities. Community health workers are already doing this work. Before COVID, over 50% of my clients needed behavioral health support. And before I could assist with addressing their needs like food, transportation, and housing, they needed to address behavioral health. I worked in coordination with behavioral health specialists on joint visits to provide those supports that they needed to bridge them to a psychiatrist, therapist, or counselor to stabilize their mental health. It is impossible to sustain housing, a primary care provider, or a host of other needs without addressing behavioral health. I was a health outreach worker during the height of the pandemic. When COVID hit, I received many more phone calls from people in crisis because they couldn't get in touch with their mental health provider, or they didn't have the support they needed anymore. I would sit on the phone for an hour or more providing social, emotional support, making sure they were safe, and providing resources like crisis hotline numbers to make sure they were able to make it through the day. Community health workers have lived experience and come from the communities they serve. Patients trusted me because I'm bilingual, and many of my clients had language barriers. I helped them feel more connected, and therefore they were more willing to engage with their healthcare needs. Unfortunately, the mental health workforce does not represent the communities they serve. 86% of psychologists, 70% of social workers, and 88% of mental health counselors are white. More than 75% of the CHW workforce is Black, Indigenous, or of color. Community health workers can increase the diversity of the mental health workforce while bringing their skills of engaging, connecting, and empowering their clients to address their mental health needs. MACHW recognizes the talents and potential of community health workers. Along with Framingham State University and the Accelerate the Future Foundation, MACHW has funded 36 full scholarships for community health workers to pursue their master's in counseling psychology. As counselors, community health workers will be able to provide enhanced support by making referrals and recognizing the social determinants of health. MACHW works with many other training centers and institutes of higher education to provide professional development, continuing education credits, and opportunities to obtain degrees. By adding behavioral health as a core competency, you are recognizing not only what community health workers currently do, but also providing opportunities for continuing education. In my 30 years of community health worker experience, I witnessed time and again the need for more mental health support, and I did everything in my power to support my clients and now other community health workers. The power is now in your hands, and I ask for your favorable support of H 1184. I appreciate your time. Thank you.
Thank you. Vanessa?
Good morning to Chair Senator Friedman and Representative Lon, and to the members of the Joint Committee. My name is Vanessa Bernesau. I live in Springfield, and I'm here on behalf of the Massachusetts Association of Community Health Workers, also known as MACHW. I support Bill H. 1184, an act relative to health equity and community health workers. As a community health worker, I recommend adding behavioral health, mental health, and substance use disorder services to the list of core competencies as outlined in Section 1 of the bill. As a Director of Community Health Services, I also recommend the Workforce Development Task Force outlined in Section 4. In my past roles as a mental health technician, a geriatric support service coordinator, and community health worker, I saw the impact of community-based services and care coordination on mental health. In my current role at a not-for-profit integrated care system, our members have very complex health needs, and behavioral health is at the forefront. While community health workers are assigned to address the social determinants of health like food, housing, and transportation, mental health overpowers any other urgent issue. Our community health workers collaborate with an interdisciplinary team where they can consult with behavioral health specialists to best address members' needs. By including behavioral health in the core competencies, community health workers are being recognized for the irreplicable work they are currently doing. When a nurse attends a home visit, they focus on medical needs. When a behavioral health specialist does a home visit, they focus on connecting clients to mental health providers. However, when community health workers attend a home visit, they see the whole person and the whole environment. Because of their perspective, community health workers can address immediate needs, but also provide preventative care through referral, resources, and socio-emotional support. This is a recognized aspect of CHW work, as studies show that symptoms were reduced in CHW-delivered interventions. Community health workers are poised to build trust and establish new connections to advance health equity because of this bill. In Springfield, we have many Vietnamese immigrants, some of whom are resistant to Western systems of medicine, including mental health support. Community health workers can better understand the cultural and spiritual needs of the community and the individual because of their experience working with diverse populations, their training in cultural humility, and their lived experiences. H 1184 will provide more opportunities to train CHW so they can better recognize mental health needs and deepen their referral networks. I also look forward to the benefits of the Community Health Worker Workforce Development Task Force. By recognizing the strengths and challenges in community across the Commonwealth, providing role clarity for employers of community health workers, and improving career advancement opportunities, we can streamline the workforce and become a more unified and visible part of healthcare systems. This bill is also part of a larger movement. The Biden administration also supports community health workers providing behavioral health support and has a long-term plan to invest in this mental health workforce transformation. Let's advance this work on the state and local level as well. I urge you to vote in favor of H 1184. Thank you for your time and for the opportunity to speak. I can answer any questions you may have.